Welcome to the deep dive. Today we're tackling a really important topic for cat lovers, feline leukemia virus, or FLV.
That's right. We've been digging into feline leukemia virus, infection basics and treatment to, pull out the key things you need to know about this retrovirus.
Yeah, our mission today is pretty straightforward. Give you a solid understanding of FLV, what it is, how it works biologically inside a cat, and really crucially, what all this means for you if you own a cat. We want to keep it clear, usable, without drowning you in super technical jargon.
Exactly.
So, okay, let's start right at the beginning. In simple terms, what actually is FLV?
Well, at its core, FLV is a type of retrovirus that's a virus with a specific way of copying itself. It belongs to the gamma retrovirus genus. But beyond the name, the big takeaway is its impact. It primarily causes immunodeficiency, weakening the cat's immune system, and also neoplastic diseases, which is the term for cancers.
Okay, so it's a serious one-two punch. And I remember reading it's not just like one single entity. There are different types, subgroups. Why is that important?
That's a great point. Yes, there are four main subgroups, A, B, C, and T. Knowing about these helps understand how the infection can vary. FLVA is, well, it's the main one. It's the most common. It's the one that's actually transmitted between cats. And you find it in absolutely all FLV infections. It's kind of the gateway virus, if you like.
The gateway virus. Okay. And the others, B, C, and T, how do they fit in?
Right, so FeLV is found in about half of infected cats. And it's quite interesting how it originates. It actually arises from a mix, a recombination between the FeLV virus and the cat's own genetic material. Specifically, these old, dormant viral bits called endogenous retroviral sequences.
Wow, so the virus is kind of borrowing from the cat itself.
In a way, yes. And this can sometimes influence the types of diseases the cat develops. Then there's FLVC, which is much rarer, only about 1% of cases. That one comes from a simple mutation, a change in the FLVA virus's genetic code.
Okay.
And finally, FLVT is specific in what it attacks. It targets only T cells, which are really vital immune cells.
Got it. So different versions with slightly different behaviors. If a cat gets exposed, say to FeLVA, what happens inside its body right at the start? Can you walk us through that initial infection journey?
Sure. Think of it unfolding in about 5 stages, sort of like the virus establishing a beachhead. Stage 1. The virus starts replicating right where it likely entered, usually the tonsils and the nearby lymph nodes in the throat area.
Makes sense. The first point of contact.
Exactly. Then stage 2. A few specific immune cells get infected. These are B lymphocytes and macrophages. These infected cells then start circulating. So they carry it around.
Precisely. They become the initial carriers spreading the virus. Stage 3 is when the infection really takes hold. The virus ramps up replication in lymphoid tissues throughout the body, also the lining of the intestines, and importantly, inside the bone marrow. That's the factory for blood cells.
The bone marrow. Yeah, that sounds worrying.
It is a critical step because stage 4 follows directly from that. Infected neutrophils and platelets, types of blood cells made in the marrow, get released into the bloodstream. Now the virus is really circulating widely.
Okay, it's gone systemic. What's the last stage in this early phase?
Stage 5 is when the virus spreads to other tissues, like glands. Salivary glands are a key one. And this is when the cat starts shedding the virus, releasing it in its saliva and urine.
And those are the main ways it spreads to other cats, right? Through that close contact.
Yes, exactly. Grooming, sharing bowls, bites, that shedding in saliva is key.
Okay, so the virus follows these steps, but not every cat that's exposed ends up persistently infected, do they? What determines the outcome? Is it just luck?
Not entirely luck, no. The cat's own immune system plays a massive role. We generally see 3 main outcomes. First, you can have an abortive infection.
Abortive.
Meaning the immune system just shuts it down really early, usually right at stage 1. It clears the virus completely, it never really establishes, and you won't find it in the blood later. A successful early defense.
Okay, that's the best case scenario. What else can happen?
Second is what we call a regressive or non-productive infection. Here, the immune system fights back effectively after the virus has started spreading a bit, maybe reached stage 2 or 3. There might be a temporary period where the virus is detectable in the blood, that's transient viremia. But then the immune system gains control and pushes the virus into a latent or dormant state.
Dormant. So it's still there, just hiding. Does that cause problems later?
Exactly. It's still present, but not actively replicating or being shed, usually. These cats often test negative later. But, and this is important, that latent virus can sometimes reactivate, or it might still contribute to certain health issues down the line, even without a full-blown active infection.
Something to keep in mind. And the third outcome is the one we typically think of with FeLV disease.
Yes, that's the progressive or productive infection. This happens when the cat's immune system just can't get the upper hand. The virus continues to replicate unchecked, leading to persistent viremia. It's constantly in the bloodstream. This usually becomes clear within, say, 4 to 12 weeks after exposure. And these are the cats most likely to develop the serious FeLV-associated diseases.
Okay. And one of those big associations is cancer. You mentioned neoplastic diseases earlier. How does FeLV actually cause cancer?
Right. The link to cancer or tumor induction is fascinating in a grim way. It happens because when FeLV infects a cell, its genetic material in a DNA form called a provirus gets inserted into the cat's own DNA.
So it's literally changing the cat's genetic blueprint in that cell.
Precisely. And if this insertion happens in just the wrong place, especially near critical genes that control cell growth, we call these oncogenes, like the famous c-Myc gene, it can disrupt their normal function. It basically flips a switch, telling the cell to divide uncontrollably.
Which leads to a tumor.
Exactly. And that disruption, particularly near Girac, is often how FeLV leads to thymic lymphosarcoma, a cancer of the thymus gland in the chest.
I see. And I've also heard about feline sarcoma viruses. Are they related?
Yes, they are. Feline sarcoma viruses, or FeLVs, are essentially mutated forms of FeLV. They rise when FeLV, during that recombination process we mentioned, accidentally picks up an oncogene from the cat's own cells, swapping out some of its own viral genes. These hybrid FeLV viruses are particularly good at causing fibrosarcomas, which are connective tissue cancers, especially in younger cats. Often they still need regular FeLV present as a helper virus to replicate properly.
Wow, that's complex. So FeLV itself can trigger cancer, and mutated versions can cause other types too. It really sounds like this virus can mess with multiple body systems.
It absolutely can. The main targets are usually the hammock, blood-related lymphatic, and immune systems. So you see things like anemia, problems with blood cell production, bone marrow cancers. And critically, KLV is a powerful immunosuppressant. It knocks down the numbers of essential immune cells, particularly CD4 plus and CD8 plus T cells. You see a drop in the ratio between them too. This leaves the cat wide open to all sorts of other infections.
So it's not just the LV itself, but the fact that the cat can't fight off other things.
That's a huge part of it, yes. But LV can also directly affect the nervous system, causing things like degenerative myelopathy, the spinal cord disease, or tumors in nervous tissue. And because the immune system is weakened overall, pretty much any organ system can become susceptible to secondary infections or developing other kinds of cancers.
It sounds devastating. So who is most at risk? Are certain cats more likely to get infected?
Well, first, it only infects cats, not dogs or humans. But within cats, age is a really big factor. Kittens are much more susceptible to developing that persistent progressive infection compared to healthy adult cats whose immune systems are fully developed.
Okay, kittens are vulnerable. Any other factors?
Interestingly, male cats tend to be diagnosed more often than females. This might be behavioral males, especially unneutered ones, might roam more and get into fights.
Ah, and bites are a transmission route, right?
Exactly. Bites are a very efficient way to transmit the virus. So lifestyle definitely plays a role. Outdoor cats, free-roaming cats, have more contact opportunities. And cats in multi-cat households, especially where cats come and go, or their status isn't known, are at higher risk.
Makes sense.
Transmission is primarily through prolonged close contact mutual grooming, where saliva is exchanged, sharing food and water bowls, sharing litter boxes. Less common than bites or grooming, but possible. And we can't forget transmission from an infected mother cat to her kittens, either during pregnancy, birth, or through nursing. That's perinatal transmission.
So lots of ways it can spread in close quarters. Now, if an owner suspects something might be wrong, what should they look for? Are the signs obvious?
That's one of the tricky things about FeLV. The signs are often really subtle, vague, and they can take months, even years, to show up after the initial infection.
Months or years, wow.
Yeah. And the resulting illnesses can be non-cancerous, often due to that immunosuppression, or they can be cancers. And remember, even those cats with the regressive dormant infections can sometimes develop serious problems later on. Plus, many of the signs of FeLV-related immune weakness look very similar to those caused by FIV, the feline immunodeficiency virus.
Okay, so not easy to pinpoint just from symptoms.
Right.
What are some specific clinical signs a vet might look for that could suggest FeLV?
Well, during an exam, things like persistently enlarged lymph nodes, a fever that keeps coming back, or unexplained weight loss, what vets sometimes call wasting, those are red flags. Also things like chronic upper respiratory problems, sneezing, runny eyes that just don't clear up. Persistent diarrhea is another one, which could be from secondary gut infections or even the virus directly affecting the intestines. And mouth problems are common: gingivitis, inflamed gums, stomatitis, periodontitis.
Mouth issues too. Okay. Anything else?
Yes, chronic skin infections or ear infections that are really hard to treat can signal an underlying immune issue like FLV, abscesses too. And then, of course, there's the cancer link. Lymphoma is by far the most common cancer we see with FLV. The risk is significantly higher.
Right. You mentioned thymic lymphoma.
Yes, thymic in the chest and also multicentric lymphoma affecting multiple lymph nodes are classic FLV-associated types. But you can also get lymphoma in weird places like the eyes or the nervous system. Beyond lymphoma, there are non-lymphoid leukemias, cancers of other blood cell types, and those fibrosarcomas we talked about, especially with FSV co-infection in young cats. And finally, some cats show neurological signs like nerve damage, peripheral neuropathies, or a progressive lack of coordination called ataxia.
Goodness, it really can manifest in so many ways. That really underlines the need for testing, doesn't it? What tests are actually used to diagnose FLV?
Absolutely, testing is key. There are two main workhorse tests. First is the IFA, or indirect fluorescent antibody assay. This one looks for a specific FLV protein, P27 antigen, inside white blood cells and platelets on a blood smear.
Inside the cells?
Yes. A positive IFA generally means the virus is actively replicating in the bone marrow, which strongly indicates a persistent productive infection. Usually this test becomes positive about 4 weeks after infection, maybe up to 12 weeks. And importantly, most cats that are IF positive will stay infected for life.
So a positive IFA is a pretty definitive sign of ongoing infection. What's the other main test, the ELISA?
Right, the ELISA enzyme-linked immunosorbent assay. This also detects that same P27 antigen, but it looks for it floating free, soluble in body fluids like blood serum, plasma, or even saliva or tears. ELISA is generally more sensitive, especially for picking up early infections or those transient viremias we talked about.
More sensitive. Does that mean it's better?
It's better for screening and catching early stages, but because it's more sensitive, you have to be a bit more cautious with a single positive result. A positive ELISA doesn't automatically guarantee persistent infection like an IFA does. That's why confirming a positive ELISA is really important, usually by retesting with another ELISA or an IFA on blood after about 12 weeks. False positives can also happen more easily with ELISA, especially if whole blood is used instead of serum or plasma.
Okay, so confirm a positive ELISA. What if the positive was from saliva or tears?
Definitely confirm those with a blood test, either ELISA or IFA. Saliva tear tests are less reliable. And sometimes you get confusing results, like a cat that stays ELISA positive but IFA negative, or has on-again, off-again positive ELISAs. This might point to a localized infection the virus is hiding out and replicating in just one spot, maybe the bladder or mammary glands, but not causing widespread viremia detected by IFA.
Huh, that adds another layer of complexity. One quick question on testing. If a cat's been vaccinated for FeLV, does that mess up these tests?
That's a really common question, and the answer is no. FLV vaccination does not interfere with either the IFA or the ELISA test results. Both tests detect the viral protein, the antigen, not the antibodies the cat makes in response to the vaccine. So a positive test means the virus is present, vaccine or no vaccine.
That's very clear, thanks. Okay, so let's say a cat is diagnosed with FLV, with a persistent infection. What can be done? Is there a cure?
Unfortunately, no. There's currently no treatment that can completely eliminate the virus from an infected cat. So the whole focus shifts to supportive care.
Supportive care. What does that involve?
It means managing the consequences of the virus. Aggressively treating any secondary infections that pop up because of the weakened immune system, that's key. Good general nursing care, making sure they stay hydrated, sometimes needing fluid therapy, and really focusing on good nutrition. If they become severely anemic, blood transfusions might be needed.
Are there any specific medications used against the virus or to help the immune system?
There are some options, though none are cures. The antiviral drug zidovudine, also known as AZT, can sometimes improve the cat's clinical condition and quality of life, but it doesn't clear the virus. Then there are immunomodulatory drugs, things like interferon, or products like Propionibacterium acnes or acemannan, which aim to sort of boost or rebalance the immune response. Results can be variable, but they might help manage symptoms and potentially improve survival time in some cats.
Okay.
And of course, treating any co-infections is vital. Like if the cat has Mycoplasma haemophilus making anemia worse, you treat that with specific antibiotics.
What about for the cancers like lymphoma?
Yes. For lymphoma, chemotherapy is the standard approach. It can often achieve remission, meaning the cancer temporarily disappears, but in FeLV-positive cats, the remission duration tends to be shorter than in FeLV-negative cats, maybe averaging 3 or 4 months, though some do better. For other blood issues like severe anemia not caused by infection, we might use erythropoietin to stimulate red cell production or certain growth factors if white cell counts are dangerously low. And we generally recommend keeping up with vaccinations for common respiratory and gut viruses, but only using inactivated or killed vaccines.
Inactivated only. Why is that?
Because modified live virus vaccines, MLVs, contain weakened but still live virus. In an immunosuppressed cat, even that weakened virus could potentially cause disease. So MLVs are a definite no-no for FeLV-positive cats.
Got it. Any other treatment cautions?
Yes, corticosteroids. While they're great for reducing inflammation, they also suppress the immune system. So they need to be used very cautiously, if at all, in FeLV-positive cats, as they could make things worse.
Okay, so management is really about supportive care, treating secondary issues, and being careful with certain meds. For an owner living with an SLV-positive cat, what's the day-to-day look like? How do you give them the best quality of life?
A huge part of it is environment and prevention. Keeping FeLV-positive cats strictly indoors is really important. This does two things. It prevents them from spreading the virus to other cats, and it protects them from picking up other infections from outside that their immune system might struggle with.
Right, protecting them and others.
Exactly. Good nutrition is vital, maybe an easily digestible, high-quality diet. Consistent parasite control, fleas, worms is important too. And regular vet checkups are crucial. How often depends on the cat's specific issues, but monitoring allows catching and managing problems early.
And thinking about prevention more broadly, what are the absolute must-dos to stop FLV spreading?
Prevention really is the best strategy. The #1 rule. Test every new cat or kitten for FeLV before introducing them to any cats you already have.
Test first, always.
Always. If you take in a cat with unknown status, quarantine them, keep them completely separate, and retest after at least 30 days, maybe longer, like 60, 90 days to be really sure, before any introductions. And then there's vaccination.
How effective are the vaccines?
Their effectiveness isn't 100%, and studies vary a bit, but they definitely can provide protection for many cats by stimulating antibodies. Inactivated whole virus vaccines are often considered quite effective. But again, testing before vaccination is critical. Vaccinating an already infected cat won't help them.
Right.
For kittens, the usual schedule starts around 8 or 9 weeks old, with a booster 3 to 4 weeks later, then another booster around 1 year old. After that, booster frequency depends on the cat's risk. An indoor-only cat might need them less often than one that occasionally goes outside, maybe every 1-3 years, based on vet advice.
Okay, so finally the big question. What's the outlook, the prognosis for a cat diagnosed with persistent FLV?
It's definitely a serious diagnosis, and we need to be realistic. Cats that are persistently viremic, the ones with ongoing active infection, have a significantly shortened lifespan compared to uninfected cats. Many studies suggest that, unfortunately, more than half of persistently infected cats may succumb to an RLV-related disease within about 2 to 3 years of diagnosis.
That's quite sobering.
It is. But it's really important to stress that this isn't a rigid timeline. The course of the disease varies hugely between individual cats. Some cats, especially with really diligent supportive care and management of secondary problems, can live much longer, maintaining a good quality of life for several years. It depends on their overall health, which specific complications arise, and how well those are managed.
So wrapping up this deep dive, it's clear LLV is, well, it's a complex and serious virus, but really understanding the basics, how it works, how it spreads, what the outcomes can be, and the options for management and prevention, that knowledge is just vital for anyone who cares for cats.
Absolutely. Testing, especially for kittens and any cats entering a multi-cat home, is just fundamental. Early detection is key.
And while there isn't a cure right now, knowing that proactive supportive care, managing those secondary infections, and working closely with your vet can make a huge difference to a cat's comfort and how long they live with the virus, that's an important message too.
It really is. And perhaps that leaves us with something for you, our listeners, to think about. Considering how FeLV operates, particularly its interaction with the immune system and its ability to cause cancer, what wider questions does this raise about retroviruses in other animals? Or even humans? What are the big frontiers in research right now? Are there parallels in how other species handle these kinds of viruses that might teach us more?